Good afternoon. It is Tuesday, April the 6th, 2021. Sego, David Lahashu Juts. Welcome to today's edition of the COVID-19 Task Force Update on this, our 198th show. This afternoon, our guests will include Lisa Westaway, the Executive Director of the KMHC, and Lloyd Phillips, Commissioner of Public Safety. And we'll start off the show with Lloyd. Lloyd?
Thank you very much, Dave. Good afternoon, everybody. I'll be brief this afternoon. I just wanted to speak on two main topics. First of all, I'm glad to report to the community that this morning, by consensus, Council of Chiefs passed changes to the emergency preparedness law. I did speak to the community on a few occasions over the past couple of months. There was much discussion and modifications done over the past several weeks, but we finally came to a consensus, our Chief and Council came to a consensus on making changes to the emergency preparedness law that would allow for a recovery phase within the emergency preparedness law. Because as the law was written, basically a state of emergency was an on-off switch, which gives mandates during a state of emergency, and when a state of emergency ends, then the mandate and directives and measures would also end with any legal authority. So what was created was what we're calling a recovery phase of emergency, whereby we could evolve out of a state of emergency, but still maintain certain mandates and certain authorities to roll out a plan to return our community back to a state of normalcy. And in that phase, there could start off, it could look very similar to what we have now, but the goal is to continue to evolve back to a state of normalcy and keep reducing measures as the weeks move forward. So that's something that we have now currently on the books, and it will be made public very, very shortly to the community. But it's the changes are regarding the need to have that recovery phase of an emergency. It will be something that's in our toolbox, so to speak. The current state of emergency ends on April 21st. At which time a determination will be made based on, again, many factors on what the recommendation will be moving forward. But certainly, there are areas that are very positive in terms of the rollout of the vaccine in our community, but also we have to be very cautious that, as you've seen, there are things happening around Kahnawà or across the province and across Canada that are very, very alarming in terms of the third wave of the pandemic and the variants and such. And Lisa will touch on that a little bit more in just a couple minutes. The next topic I want to update the community on is what's, again, happening tomorrow in terms of the decision made to offer vaccinations to non-residents who work in various industries within the community. After some deliberation going back a couple of weeks ago, we felt it was important that we include certain individuals who work primarily in the service sector, who service Kahnawà on a regular basis, multiple households on a regular basis, and are not from the community to be vaccinated. That will give the extra level of protection for our community. So we did put a call out last week for people to submit the list of names, and there was also a outreach that we had people contact in various businesses, asking them to submit a list of names. We did receive a lot of people over and above the service industry who did contact us and asking for their employees to be vaccinated. Unfortunately, we cannot vaccinate every single person who made the request. We cannot vaccinate every single person who comes into the community, but we much like we expanded the vaccination to essential service employees and critical roles such as social workers, such as teachers, bank workers that are crucial to the operation of our community. We expanded this to the service sector. So we feel that it's important to get these people vaccinated, but it's also part of a larger plan because we know many of these sectors are currently closed, and the sooner people are vaccinated and the sooner people build immunity, the much more confident we are making steps moving forward, looking at down the road in the coming weeks to start opening up, reopening certain businesses in the community. So we're trying to get the economy moving as well, but again, doing it in a safe and proper manner. So for all you people who have submitted lists, as we speak right now, there are calls being made and appointments being booked for people to receive their vaccination tomorrow. And so if you receive a text message, and with your appointment, that is your time slot to show up at the bingo hall to be vaccinated. And again, Lisa can speak to that in a little more detail in just a minute. But again, this is, I just wanted to reach out again and explain very briefly to the community that we understand that everybody out there who's associated with Kahnawà and who's a non-resident wanted to be vaccinated. But I remind you as well that our primary goal as a task force was to vaccinate Kahnawà, and that still remains and still has been our focus, and we're doing very well in that area. Then we expanded to essential service and critical roles, and then we were fortunate enough again to expand it to a little further. But we have to stop at a certain level, and that's where we're at now. So at this point, we're not accepting any more non-residents who work in the community. Their appointments will be booked, they will be vaccinated, but we had to draw a line basically, and that line has been drawn. So we're fortunate where we are, but we can't possibly vaccinate every single person. Quebec is still rolling out their campaign. If you are a non-resident employee, you have the process set out in the province where you can get your vaccine scheduled when your age category is released by the province. Again, it's a positive development. We're moving forward as a community. Things are still at a critical phase overall, but again, there are those positive movements. And this want to re-emphasize, even though tomorrow we do have this special vaccination for non-resident employees, if there is any Kahnawà out there who still wants to be vaccinated, you are still eligible to show up and you will be vaccinated. We do not want to turn away anybody from Kahnawà who changes their mind at the last minute and wants to be vaccinated. So with that, I'll turn it back over to Dave, and more information about the vaccines will be coming by Lisa. Thank you.
Thank you very much, Lloyd. Up next is Lisa Westaway. Lisa?
Thanks. So just some update about our percentage of population vaccinated. So we've recrunched the numbers over and over, and what we've come to is 72%. So that's really amazing. 72% of eligible 18+ population has been vaccinated as of last week. We have not added in today's numbers. Today's numbers will increase our percentage because we're already at 104 people last I checked who were vaccinated today. So that's a really great job. This is, of course, we were aiming for 80%, but this is really very, very positive numbers, and will go very far in protecting our community in the future, especially as we see number of cases starting to increase around us, and both with respect to the variants especially. And we are expecting an announcement at 5 o'clock. We still are not sure what will be presented at 5 o'clock, but we do expect additional restrictions to come about in the cities or communities around us. So we are in a positive place right now, considering that we do have a high number of people who have received their first dose. So that being said, we still have to remember that there are some significant risks in the community, even if we are highly vaccinated. And this means that we have to continue with the measures that we have in place, meaning distance, hygiene, and masking. We have to continue to worry about the well-being of others, because we still have to keep to ourselves as much as possible. We have to follow the public health measures that we have here in Kahnawà, meaning only a maximum of 8 people outdoors, only 2 households indoors. We cannot go against these measures at the present time because there still are some unknowns related to the variants, and we still don't have enough data that can indicate how well the vaccines work against the variants. And we hope to get that information soon so that we can make some decisions for the community that will ease some of the pressure that we've all been feeling. But as of today, we still don't have the information that will allow us to move forward in that sense. So although we have relaxed measures, and we urge you to see your families and to follow the measures in the way we've described them, however, to continue to protect yourselves and others so that we can eliminate transmission of the virus. The testing site is open today. We see that there are a large number of people who have come in for testing. This is important to identify. We are still seeing COVID-related symptoms. We urge you to come in and be tested. It's by identifying COVID cases that we ensure to limit the transmission of the virus. We don't want to have any large outbreaks. So we have to really continue, again, like I said, to follow the measures. So as we announced last week, we will be receiving a shipment of Pfizer next week, where we will be vaccinating 16 and 17-year-olds. We'll also, at the bingo site, going to be vaccinating a second dose for our employees who are at their 112-day mark. So the vaccination site will continue to operate next week, and we'll be giving you more details about scheduling for 16 and 17-year-olds by Thursday. Lloyd mentioned something important to anybody who changes their mind, and it is possible that you might change your mind and want to be vaccinated even though our mass vaccination campaign is finished. So just to explain, with Moderna and Pfizer, there are 6 or 10 doses in a vial, and therefore we can't just randomly vaccinate one person at a time. This has to be structured, organized, logistics have to be prepared. And so if you do change your mind, we want to make sure that you have the opportunity to be vaccinated. You can call the task force number 632-0635, give your name and phone number, and we will be accumulating names so that we can find a way to ensure that you are vaccinated. If we cannot do it here because the numbers are low, then we'll assist you in understanding and navigating the public system and how or where you can be vaccinated in the communities that surround us. Also, just to mention that the pharmacies in the community will be starting a vaccination campaign as well. They will be receiving Moderna, and we'll be getting more information about that soon, so you can look out for that on public posts. Lloyd mentioned about tomorrow and the vaccinations for employees of some of our Kahnawà organizations or businesses. So again, just to mention that you will not be receiving a phone call. You will be receiving a text message with your appointment time and date. It will be tomorrow. I think we'll be able to vaccinate most of you tomorrow, so you should be receiving a text message and not a phone call. So we're expecting you to show up at your appointment time. We don't have the luxury of changing or offering multiple vaccination dates or times, so you are expected to come to the bingo hall at the date and time that is indicated in your text message. We've been made aware that some businesses gave one and one only telephone number for all of their employees, so that one number will receive all of the appointments, so you'll have to have the responsibility of sharing that information with your staff. Again, we have chosen to vaccinate community or non-community members in this way to protect the community. It's for people who have repeated contact with community members on a regular basis. So again, that's it for today. We'll be providing you with more information about scheduling for the rest of our vaccination campaign for 16 and 17-year-olds, and we'll be keeping you up to date with respect to second doses for those who were vaccinated during our first campaign, which right now is scheduled at 112 days. For those of you who have your appointments, that's great. For those of you who don't, you will be contacted by us in the coming weeks. Okay, thank you.
Thank you very much, Lisa, and thank you very much, Lloyd, for all that information. And that's it for our show this afternoon. From all of us here, Yawagoa, Danu, Onagiwahi.